The PANORAMA Study was a large randomized clinical trial that was designed to evaluate the ability of intravitreal aflibercept to demonstrate regression of diabetic retinopathy in patients with moderately severe to severe non-proliferative diabetic retinopathy. We evaluated a total of 400 patients in 3 different treatment arms. First was a treatment arm consisting of intravitreal aflibercept every 8 weeks after a loading period. The second group was every 16 weeks after a shorter loading period compared to the current standard of care, which was observation. So the good news for surgeons is that intravitreal aflibercept injection dramatically improved regression rates of diabetic retinopathy. Patients that were treated with intravitreal aflibercept had regression rates between 65 and 80% in terms of two-step regression of their diabetic retinopathy, compared very favorably to the sham group. The other good piece of information is that intravitreal aflibercept dramatically reduced the rates of vision-threatening complications such as neovascular diabetic retinopathy, as well as center-involved diabetic macular edema. Regardless of treatment schedule, the reduction of threatening complications was 80% in the active treatment group. So we really are perhaps changing the long-term prognosis of these patients that have vision-threatening disease. Another very interesting finding is that the more severe the retinopathy at presentation, the more likely patients would have regression as well as reduction in vision-threatening complications. So patients with more severe disease had a more dramatic response to treatment. Patients with less severe disease had a great response, but patients with more severe disease have a dramatic, greater than 90% chance of two-step regression with intravitreal aflibercept. Well, the ultimate benefit for patients is that, from my perspective, we may be able to turn back the clock in terms of diabetic retinopathy regression. Diabetic retinopathy now is the #1 cause of blindness in the United States, and this important treatment gives us the opportunity to regress retinopathy, effectively turn back the clock of damage to the retina. So we believe with further study that we may be able to understand that we're changing the dynamics of the disease.